Live from Studio 5, this is NBC 5 News Today.
From jack-o'-lanterns to candy, what's the trick to getting the right stuff? The best Halloween candy. An expert coming up with what's actually good, well, if not good, better for your children's teeth. The perfect sound effect for what we're about to talk about, which is all the Halloween candy that kids are going to eat. We asked pediatric dentist Dr. Grace Yum to join us, and there's in fact some candy that's better than others when it comes to a child's teeth, right?
Yes, absolutely. Well, happy Halloween. I love Halloween. I love trick-or-treating and candy.
And you love chocolate.
And I love chocolate. So I brought all the kinds of candy that you typically see in a trick-or-treating bag.
Right.
And I'm going to start with asking you, what is your favorite candy?
I love toffees and anything chewy, which you're probably going to tell me is not such a great idea. I knew it. I knew it.
But you know, I'll tell you what. I'll start with what's best for your kids' teeth, and we'll go all the way to what's not so great.
Chocolate is the best.
Yes, chocolate is the best because it's not in the mouth for very long. You eat it, you chew it, you're done. It doesn't stick to the teeth. And so it's great, and there's all different kind of varieties, but my favorite is this one right here, the dark chocolate, because the dark actually has antioxidants in it, so it's pretty good for you, you know?
The key here is the less time that sugar spends in your child's mouth, the better.
Exactly. The longer sugar is in your mouth, the more likely you'll develop a cavity.
Now, candy corn is, of course, a classic Halloween treat, right?
Of course. You know, you see it everywhere, especially this time of year. It is pure sugar. That's why I put it in the middle category, because it's not as sticky as some of the other candy.
But it's still a little
chewy. But, you know, it's not as bad as what I'm going to talk about next.
Okay.
You know,
of course, my favorite.
Oh, your favorite. Pick it up.
Caramels. I love these. I love
you know, the caramels, these stick in your mouth for a long time, and they stick. So when you're getting your finger and you're picking, you know, the candy off your teeth, then you kind of know, okay, maybe I need to stay away.
And if it's a little kid, you probably aren't going to be able to get it all out.
Exactly. And you know what? The blow pops, yes, there's fruit on the picture, you know. You think it's good, but this is a double whammy because it's hard candy on the outside and it's chewy in the middle.
Right.
So it's in the mouth for a while. So again, you might get cavities. Now, I wanted to give some tips, you know, share some tips. One being you need to ration, as a parent, ration the candy. When I was a little girl, my father would make me dump my candy on, you know, the floor, and he would say, okay, 1 for you and 2 for me.
And that's really the point, because the less you eat, the better. And if you make it a real treat, you know, if you can. I know that some parents will say that's really difficult. Also, of course, brush today.
Yeah, and I tell my patients 2 minutes morning and at night, but I think tonight, especially with all the treats, you want to brush a little longer. And parents, you know, my mother would say, I'm watching you, you know, watch your kids, make sure they're not in the bathroom for 10 seconds.
Right. And you know what? It's just taking control of the candy, not necessarily just in rationing, but putting it someplace else. Not in their bedroom.
Not in their bedroom, but hide it. And maybe after a week, get rid of it.
All right. Yeah. Okay. Thanks so much for joining us, Dr. Yum. Good tips. And up next, we thought we would think about apples.